So there are options of different types of breast cancer surgery. There's the lumpectomy or breast conservation, where we take out the tumor with a rim of normal tissue. And there's a mastectomy, where we remove the entire breast. The main difference between the two surgeries are the risks of complications and the recovery. With a lumpectomy, it's a small outpatient surgery, and generally the recovery is pretty quick. Some patients even have surgery on Friday and go back to work Monday or Tuesday. Some patients take about a week or two to recover, but generally people are living pretty normally after a lumpectomy and recover pretty quickly. With a mastectomy, most patients are offered, or all patients are offered reconstruction actually, and that's with a plastic surgeon. It's considered part of your breast cancer treatment if you choose a mastectomy. Depending what type of reconstruction you have for your mastectomy, that will impact your recovery. But a recovery from a mastectomy, with or without reconstruction, is typically more like 4 weeks. And if you have a certain type of reconstruction called a flap, that could be closer to 8 to 10 weeks. So the recovery really varies depending on which surgery you choose. In terms of risks of complications, there's risks of bleeding, infection. With a mastectomy, sometimes you can have what's called skin necrosis or skin loss. Of course, if you have an implant placed and there's an infection complication, you could lose your implant. These are rare complications. With a lumpectomy, some patients have to go back for an additional surgery to remove more tissue. That's called re-excision of a margin. We don't necessarily consider that a complication, but it is something that patients need to be prepared for and something that we discuss in their consultation if they choose to do a lumpectomy. One of the more common risks of breast cancer surgery that we talk about is related to the lymph nodes. For most patients with breast cancer, we will have to remove some lymph nodes from your armpit to determine if the cancer has spread to those lymph nodes. We try to take just a few lymph nodes called sentinel lymph nodes, which are the key lymph nodes for the breast. Some patients require us to take all the lymph nodes in the armpit to treat their cancer. Regardless of how many lymph nodes we take, there is a risk of something called lymphedema. That's where the fluid in your arm gets trapped and your arm gets swollen and heavy because the fluid in your arm drains through these lymph nodes in your armpit as well. If we do a sentinel lymph node procedure where we are only removing a few lymph nodes, the risk of that is about 5 to 10%. If we have to remove all the lymph nodes in the armpit, the risk goes up to approximately 20%. So that is another one of the complications that we discuss with patients when they come in to see us. But generally, breast cancer surgery, people recover pretty quickly and do really well with breast cancer surgery. I look forward to meeting you. Please visit us at basccancercenter.com to learn more about me and how to schedule a visit.